Welcome to our group study session today. How you guys doing?
Good, how are you?
I'm good. So I saw that today is my turn to be doing our crash study course. So I figured maybe we could make it a little bit fun today, do a little bit of maybe Pictionary, add a little bit of Family Feud, kind of get us ready for next week and get us going for the rest of the term.
Perfect.
Sweet, let's do it.
Okay. So today's topic, I was thinking we could talk Crohn's disease, one of the most common irritable bowel disease that we see. Is that okay with you guys?
Yeah, let's do it.
Okay. So I was kind of looking over Crohn's disease. I think this is a very important part as future nurses. We're going to see this more often and probably see a lot more patients with this disease. So I just wanted to kind of talk about what the disease is. We'll go over some clinical manifestations, do some NCLEX style questions, draw some pictures so we can be prepared for next week. Is that okay?
Perfect.
Awesome, sounds good.
All right. So Crohn's disease is actually an inflammatory disease that affects the entire GI tract. So we're talking from the mouth all the way to the anus. It leads to thickness of the intestinal wall and affects all layers of the submucosa. So what happens with it is there's a higher number of T cells, immune globulin, and macrophages. As an autoimmune disease, the body kind of attacks itself. Clients can go into readmissions and exacerbations of the disease. What happens, it leads to inflammation, otherwise known as edema. And you gotta get those reddish purple discolorations. Clients you'll often see will have skip lesions where there's a group of healthy tissue and not so healthy tissue are the areas that are affected that aren't affected. Clients can also get anal fissures, which is caused from ulcerations due to that chronic diarrhea and just that acidity coming out of the rectum. You can get the crypt abscess from red blood cells, lymphocytes, leukocytes, and other debris. A key clinical manifestation that we'll kind of see with this disease is cobblestoning. I don't know if you guys are familiar with that, but it's a development of the granulomas that occur from the disease process. And due to this, it places the client actually at higher risk of infection. And what happens during this disease is you'll see that the lumen of the intestinal wall will actually narrow and shorten. Welcome to our crash study course of Pictionary Crohn's edition. Today I'm going to be giving these two 4 clinical manifestations and they're going to draw it on the board, but the fun thing is neither of them are going to know what the other one is drawing. I'm going to show Christine a card, she's going to draw, Jen is going to guess. You got 30 seconds on the clock. As soon as that 30 seconds is up, you'll hear the buzzer, time is up. Jen, you're going to guess as soon as she starts drawing, and go.
Oh man, okay.
Tongue. Oh, no, a shirt. An intestines. Large intestine.
Yes.
I don't think you can talk to me. Oh my gosh. What are those? Holes. Diverticuli. No. Cobblestones. Did I do it?
Yes. Yes, it was cobblestone.
Woo!
Switch.
Oh. I'm looking at our host.
All right, Jen, again, 30 seconds on the clock. I'm going to give you a card, and Christine, you're going to guess what it is.
Boobs.
Oh, this does not look like
Penis. Butt. Anal fissure.
Good job, Christine. All right, and switch. We're going back. Okay. 30 seconds on the clock as soon as you erase.
That eraser is horrible.
And go.
Okay.
A butt. Oh, a big butt. Poop. Bloody poop. Diarrhea. Bloody diarrhea.
Yes. Good job. All right, last clinical manifestation. again. You're gonna get 30 seconds.
It's too much stress. I can't take this. Okay.
And go.
Oh.
Person.
The Exorcist.
Vomiting.
Okay.
You did great. I hope those pictures are now embedded in your brain and you can kind of get that picture when you're really doing that exam next week.
Yes, I will always remember
So
a
why
large
I'm in,
booty and the anal fissures.
why I'm in nursing school and not an art major.
Exactly. So you guys did great. I kind of wanted to embed those clinical manifestations that we more often see in clients, but there's some important ones that we need to be aware of also. It can kind of be hard because they can be similar to the ulcerative colitis and kind of a combination with those irritable bowel diseases. But one thing is malabsorption. And you'll often see the client losing a lot of weight because they can't keep those vitamins and minerals like the zinc, the iron, the vitamin B12. They're all going out in their stool when they're having this chronic diarrhea, so they often will lose weight. They could have many loose bowel movements a day. Exacerbations and remissions can happen. You often see this with like chronic laxative or antibiotic use if they're under emotional stress or if they're eating certain foods like fried foods or consuming a lot of alcohol.
At the head. Here I would go ahead, take a look at your eyes, ask you if you're having any blurriness, any sensitivity to light.
Yes.
Okay. And then I would go ahead and look for any redness in your eyes, any swelling, look at the conjunctiva, everything.
What are we looking for in my conjunctiva?
We're going to look for any, redness there too, as well as a sclera, and then we're also going to look for paleness, because that could also be a sign of anemia.
Aha. Okay.
And then we're going to go down to the mouth. If you have any soreness, any sore throats, any cuts in there,
Like just like regular cuts?
any
or
like lesions.
so like ulcers or like canker sores?
Yes.
And but why if Crohn's affects would be all up in this business, why would it be all up in this business?
Because it can go from the mouth to your anus, so
Ah.
it can actually happen in the mouth too, and you're more prone to get canker sores as well on
Okay.
the lips.
Alright, so you tell me.
Go ahead and look at the mucosa.
Uh,
Everything looks good.
Ah.
And I think that should be it for the head.
Yeah, I kind of like besides your head and your eyes, your mouth, look at that. I'd kind of go onto the cardiovascular system, making sure that your heart rate is good. With a lot of fluid loss due to Crohn's disease causing diarrhea, electrolyte loss is a real possibility, which can cause arrhythmias. It can cause your blood pressure to go low. So making sure that your heart rate is stable, your vital signs remain stable, you're not having any type of palpitations or fluttering feelings in your chest would be something that I would definitely want to assess. I'd also want to assess your abdomen, obviously. I'd want to know what your bowel habits were, asking you when your last bowel movement was, the consistency of your last bowel movement, what your fluid intake's been, kind of make sure that what you're inputting into your body is matching what's coming out of your body. I'd also want to make sure that I listen to bowel tones, make sure that her bowel tones are present. They generally are hyperactive in a patient with Crohn's, so being aware of what's normal, what's abnormal with a patient. I'd also want to palpate for any areas of tenderness that you're having.
Okay, you guys did a really good job on the head to toe assessment, what you would really focus on with those body systems. So props, good job. I assigned each of you a specific body system that is impacted for this disorder. So I know we kind of talked about the digestive system, which is obviously the main cause of this disorder, but just because this disorder affects the digestive system doesn't mean it doesn't affect other parts of the body as well. So we talked about it affecting the mouth down to the anus, causing those the fistula, the edema, the swelling, that purple discoloration, the skip lesions. Brenda, you pointed out really well that you get those sores on the mouth because it does affect the mouth, and a lot of time people forget about that. So that was a good point to add into that skit that we just did. So I'm gonna start with you. I think I assigned you cardiovascular, right?
Because we're dealing with a lot of high output and with a lot of nausea and vomiting, patients can often be pooping way more than they're able to intake. So which could lead to electrolyte imbalances and weight loss and chronic fatigue. And all of those things are going to be affecting the cardiovascular system. So if our sodium is out of whack, if our potassium is out of whack, if our magnesium is out of whack, if we're we are not eating enough, so we're not replenishing our body supply of iron, we're going to be developing anemia, and all of those things are going to manifest in dysrhythmias. So we could be experiencing, like earlier we talked about in our lab, heart palpitations. We could be dealing with some tachycardia, like all as the heart is trying to work faster to try and accommodate all of these electrolytes that are not able to help properly, how would you guys say that? Like to not there to properly support all the cellular activity in the body.
We're having those cellular shifts from the intracellular to the extracellular, causing that cellular dehydration. So that's really good.
Yes, thank you.
I had the integumentary system, or the skin. So another body system that it affects, obviously lesions. It's a chronic inflammatory disorder, and so chronic inflammation is a problem. And that includes areas on the outer part of the skin too. So patients can be prone to red bumps, pus filled, and deep ulcerations on their skin, and there's damage due to the endothelium that makes it become rough and inflamed. So that's an area of their body as well that you need to keep an eye on, and that can also be affected by this disease. So
I also want to point out that I completely forgot that having Crohn's disease can also make you more at risk for DVT and PE, so pulmonary embolisms and deep venous thrombosis, yes,
blood clots.
blood clots, because of those irregular heartbeats leading to stagnation in the blood. Yep.
Good job.
I have the eyes again. So as Jennifer said, it's chronic inflammation, so it can also cause inflammation of the eyes, and it can cause redness and then sensitivity or blurred vision. And a lot of these symptoms do resolve though once Crohn's is under control.
Good job. So one thing I did want to point out to you guys is in nursing, obviously we're big advocates for our clients. And so we have to remember that this is an autoimmune disease. This does affect patients for life. It's not a curable disease, but it is manageable. And we need to make sure that we're there for our clients. You know, they're at higher risk for depression, anxiety. You know, they may be questioning, why is this happening to me? And kind of stepping back and not just, again, caring for their disease process, but caring for them holistically, asking them how they're doing, asking them what they need, and just being present with them is really important as nurses, just having that helping hand when somebody is very vulnerable and emotional.
Well, and it's a very private type of condition.
Yes.
You know, that's the symptoms are not symptoms that people want to have happen.
Nobody wants to tell you they have large
Diarrhea
episodes
and,
of bloody
you know,
diarrhea.
yeah.
And I think we did really good today, you guys.
Sweet.
So I figured I'll ask the question, I'll give the answers, and you guys want to shout them out?
Let's go.
Team collaborative approach. Okay. So we have a 36-year-old man presenting in the emergency department with complaints of abdominal pain and bloody diarrhea with mucus. He states he has noticed he had a poor appetite and is losing weight. During a colonoscopy, the doctor notes anal fissures, edematous reddish purplish tissue with fibrosis, and shortening of the colon. After a pathological analysis of biopsies, the doctor diagnoses the client with Crohn's disease. The nurse knows that which of the following are also characteristics findings of this disease. Our favorite, select all that apply. So we have A, cobblestoning.
Okay.
B, pseudopolyps.
Okay.
C, it helps predispose colon cancer. D, skip lesions. Or E, it involves inflammation of the large bowel only.
Oh,
I know it's not pseudopolyps.
because that one
That's ulcerative
that's
colitis.
ulcerative colitis.
And it's also doesn't predispose to colon cancer generally.
That's
Not
Crohn.
that-
That's ulcerative colitis.
That's
Really?
ulcerative
I thought
colitis.
that it was also for Crohn's too.
No, that's
Oh,
ulcerative colitis.
okay, and then it also doesn't only affect the large bowel because it can be anywhere from top to bottom.
My guess is A and B.
Yes.
Okay, so you said, so it's what, skip,
Cobblestone.
Cobblestoning
and skip
and
lesions.
skip lesions.
You are correct. Style question. This is a priority nursing intervention question to kind of see where you guys are at with your critical thinking, okay?
Alright.
So, last question. You are a nurse in the emergency department and have just received a report on a newly admitted client with an exacerbation of Crohn's disease. The client states they have had abdominal pain, copious amounts of bloody stools, and little oral intake over the last 3 days. The nurse should anticipate which of the following priority orders from the physician. A, a stat colonoscopy to assess for cobblestoning.
Okay.
B, obtain blood work to assess patient's electrolyte levels.
Okay.
C, place the client on a cardiac monitor and administer intravenous fluids. Or D, administer pain medication for patient comfort.
Well, I feel like the stat colonoscopy is dumb because they're already diagnosed with it. So why are we going to go and look for
Yeah.
cobblestoning?
No, I
It's
agree with you on
probably
that.
already there. I feel like we should totally address pain. That is a thing.
But I don't think it's
But
a
is it
priority.
priority? I'm like,
Same with the blood work. Like I feel like they'll get blood work on the patient, but I
It's
don't
not a
feel like
priority.
it's like a priority. My guess would be C, because you're going to assess the patient or place the patient on the monitor, so you're monitoring your patient and you're administering IV fluids.
right, to replenish the fact that they haven't been eating or drinking anything, and then there is a good chance that they could be having some sort of cardiac imbalance. Not cardiac imbalance because of an electrolyte imbalance happening here. So I think I will agree with that too.
C.
C.
Great job. All right, ladies, we are done.
All right, everybody, hands in. We will rock the final. Ready? What do we say?
Patho rocks.
1, 2, 3.
Patho rocks!